Question. A 35-year-old male presents with sudden-onset chest pain radiating to the back and blood pressure of 160/100 mmHg in the right arm and 120/80 mmHg in the left arm. On examination, there is a diastolic murmur heard best at the left sternal border. What is the most likely diagnosis? A. Acute myocardial infarction. B. Aortic dissection. C. Pericarditis. D. Pulmonary embolism. Correct answer is B. Aortic dissection. Key symptoms. Sudden-onset chest pain radiating to the back is classic for aortic dissection. Blood pressure discrepancy between the arms is another hallmark sign due to involvement of the subclavian arteries. A diastolic murmur suggests aortic regurgitation, which occurs when the dissection affects the aortic valve. Other options explained. Acute myocardial infarction, AMI. Chest pain is typical but does not radiate to the back, and there is no BP discrepancy or murmur. ECG and cardiac enzymes would confirm AMI. Pericarditis. Chest pain worsens with inspiration and improves when sitting up. No BP discrepancy or diastolic murmur is associated. Pulmonary embolism, PE presence with pleuritic chest pain, shortness of breath, and tachycardia, but not BP discrepancy or diastolic murmur. Clinical pearls. Aortic dissection is confirmed with imaging, such as CT angiography, which shows an intimal flap. Early recognition and treatment, surgical or medical, are critical to prevent complications like rupture or organ ischemia.